So the healthcare division has been around with the Chamber for probably 7 or so years, and they've always had a state of healthcare. And what they like to do is bring in CEOs from various health systems and have them have sort of a State of the Union discussion on what's going on in healthcare. So as the chair of the Chamber's healthcare division, I reached out to 5 system health CEOs that were on the panel today, formulated a list of questions and some topics for us to discuss, to kind of talk about the nuance and what was going on in healthcare, and certainly pivoted a little bit this morning with recent developments of COVID-19 and the coronavirus, to have a majority of the hour spent discussing what the audience should be aware of, what they should be prepared for, and certainly what potentially would affect them.
5 years ago, we were talking about Ebola. Today, we're talking about the coronavirus. What hasn't changed, which is a topic of conversation and has been, is affordability of healthcare, access to healthcare, the trends and technology in healthcare. And we see that it's continuing to be more consumer driven. Compared to where it was 5 years ago and compared to where it is today, convenience is something that the consumer wants. And so that's where a lot of the healthcare is moving towards.
So healthcare is in everyone's life, whether you have insurance, you don't have insurance, you don't have enough insurance. So it's a topic and an issue that you can't move without getting away from. So I think a lot of times people can develop their own opinions, and it's sometimes really nice to go to professionals and have a direct access to that affects you. 1, to answer questions that you need answered. 2, and probably more importantly, to dispel any myths or maybe misinterpretations that you might have about healthcare.
I think it's important, simply put, because healthcare is important for all of us. The health of your loved one, like your parent or your child, it's an important aspect of who we are. And so for me, it's important to make sure our community is informed in what's going on in healthcare. Because it's not just about the hospital and what we do, but it's really about what we're doing to impact the lives of the community.
So I would encourage you to stay on top of the news, keep an active role as to see what's going on. Certainly follow the county's role at the health department's suggestions and practicing basic hygiene and staying away from crowds. And certainly if you are sick, staying home.
I encourage folks to be actively involved in their local chambers. So when they put on forums such as this, in regards to what's going on today, I encourage members that are interested to look at the CDC website to get real-time information on what's going on with the coronavirus, what questions they may have or clarity they may need. But to stay connected.
I think the instructions they're providing are certainly where you want to get your information. Be real careful to vet your sources and don't accept misinformation. And then beyond that, just in today's event, I would say be an active participant in your healthcare. Everyone is going to access the system at some point in their life, so it's better to be knowledgeable than not when it comes to your own health.